Hello, I'm David Ball, District Athletic Specialist for Buncombe County Schools. I would like to welcome our BCS staff and students back as we reopen our school campuses for extracurricular activities. Preparations have been made and new protocols have been established to make this return as safe as possible. Things are going to be different. This discussion will serve as an educational training guide for our staff and students related to the screening process and hydration policies. With help from local experts, we'll learn more about COVID-19 prevention and get a chance to step onto the field during a screening exercise. Now, let me review a few of the changes and new protocols that will be in place. First, students should dress at home and come to the school campus ready to participate. Students should bring their own water bottle each day. Students should arrive no earlier than 15 minutes before their scheduled activity. Upon arrival, students should report immediately to the designated screening location. Hand sanitizer will be used by each participant before starting any activity and at the conclusion of the day's activities. Students are expected to wear facial masks while on campus, except for while they are participating in specific activities. There should be no physical contact by students or staff, no high fives and no handshakes. Physical distancing of at least 6 feet should always be maintained. Finally, at the end of the day's scheduled activities, students should leave campus immediately. No congregating. These are just a few of the basic protocols that will be in place upon your return, and I encourage you to follow them. If you have a question, ask your coach, your director of activity, or your school sponsor. Each one of you needs to be a true teammate as you participate in activities during this crisis. Be safe, wash your hands frequently, maintain physical distancing, wear your mask, be honest in all aspects of the screening process. Be a true teammate, true bandmate, true schoolmate. Let's all work together to keep everyone safe as we reopen our schools.
COVID-19 is a disease caused by a virus. The virus is called Severe Acute Respiratory Syndrome Coronavirus 2. The symptoms of COVID-19 may appear 2 to 14 days after exposure. Common symptoms sometimes can include fever, cough, shortness of breath, muscle aches, chills, sore throat, loss of taste or smell, headache or chest pain. Less common symptoms are rash, nausea and vomiting, and diarrhea. Some people may have only a few symptoms, and some people may have no symptoms at all. COVID-19 is thought to spread mainly from person to person through respiratory droplets produced when an infected person sneezes, coughs, or talks. The droplets can land in the nose or mouth of people who are nearby, or possibly be inhaled into the lungs. Spread is more likely when people are in close contact with one another. A person can also contact the virus when touching a surface that has the virus on it, and then touching their mouth, nose, or eyes. People of all ages can be infected. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease, severe obesity, chronic kidney or liver disease, or someone who has a compromised immune system appear to be more vulnerable to severe illness with the virus. To help prevent the spread, everyone should clean hands often with soap and water for at least 20 seconds, or hand sanitizer that contains at least 60% alcohol. Avoid close contact with people who are sick. Practice physical distancing by staying at least 6 feet apart in public spaces. Cover mouths and noses with cloth face covers in public settings. Cover coughs or sneezes with tissue, and then throw the tissue away. Wash your hands immediately. Clean and disinfect frequently touched objects and surfaces daily. There's currently no vaccination for the virus. Anyone who begins having symptoms should separate from other people and contact their medical provider. Anyone having emergency signs or symptoms, including trouble breathing, persistent chest pain or pressure, inability to stay awake, new confusion, blue lips or face, should seek care immediately. Healthcare professionals are working tirelessly to treat COVID-19. but prevention is everyone's job.
Welcome everyone, I am Joel Moffitt, athletic trainer for Irwin High School and PT Solutions Physical Therapy. I'm glad we're finally getting back together to start some sporting activities. So here are some guidelines we're going to cover to keep you safe during those times. No participant can arrive 15 minutes before their scheduled workout time, and they must leave immediately after their time is over. No congregating. Both staff and students will be screened prior to activity every day. A record will be kept of the results, including your name and date. And one thing to remember, when you wake up in the morning to get ready to come to your activity, there will be no locker room, so you need to dress ahead of time. Come prepared in your clothes to participate in your activity. Also, bring a water jug and a mask to use during the practice. And if you have a thermometer, take your temperature at home. If it's over 100.4, do not come. Next, we're going to show you what to expect when you come to the screening station. Welcome to the school. Now that you're here, when you get out of the car, make sure you get your bottle and your mask. Report to the screening station, and remember to use your social distancing and your 3 W's. Your 3 W's are wear your mask, wash your hands, and wait in line at the appropriate distance. The screening station will have signs and social distancing marker to help the process. Parents, do not leave until your student is cleared for practice. All right, so I'm going to put my mask on so I can be safe and help out these guys with the screening process. All right, so we're using coaches today as athletes, so we're gonna let them step up and help us out here. Come on up here and we'll get you first. I'm gonna ask you a few questions as we do the screening process. First is, have you had any racing, fluttering, or skipping beats of your heart?
No.
Have you had any unusual dizziness during or after exercise?
No.
Have you had any cough or shortness of breath?
No.
Do you have a sore throat?
No.
Do you have any new loss of taste or smell?
No.
Do you have any diarrhea or vomiting?
No.
Do you have a household member with COVID?
No.
Have you had close contact with someone with COVID?
No.
Okay, we're going to take your temperature. Stand right here. We're going to touch your forehead. Okay, good. Now, once you've passed that, we're going to give you a bracelet so we know that you've passed today. And then you're going to walk over here, keep your social distancing, and wait at the proper markers until your coach takes you to the field. Okay, for this next patient, we're going to pretend that he fails. So you come on in, I'm going to ask you the same questions that I asked the other ones. Have you had any racing, fluttering, or skipping beats of your heart?
No.
Have you had any unusual dizziness during or after exercise?
No.
Have you had any coughing or shortness of breath?
No.
Have you had a sore throat?
No.
Had you had any new loss of taste or smell?
No.
Have you had diarrhea or vomiting?
No.
Have you had a household member with COVID?
No.
Have you came in close contact with anyone with COVID? No. Okay, let me get your temperature real quick. Okay. You have a fever, unfortunately, so is your mom or dad still here?
I think so.
Okay, if they are, then we're going to isolate you. I'm going to let this coach take you to the isolation place. We'll contact your parents and they'll take you home so you can be seen by a physician. If you'll just follow him. Now we're going to show you how to properly use the hydration station. When you arrive, you can lay your bottle down on the table while you wash your hands with the hand sanitizer. So as you're washing your hands, they say to use at least 20 seconds or sing happy birthday while you're doing it. You want to make sure you get between your fingers, around your thumbs, and around your wrist to properly wash your hands. When you have finished that, then you can take the bottle and fill it up, making sure not to touch too many surfaces. The people that are waiting in line to fill their bottles should remain 6 to 8 feet away, practicing social distancing. When you have finished, you can head over here to your coach or your field for your next activity. We do want to just reiterate a few things. Social distancing. Remain 6 to 10 feet apart at all times. There's no touch policy. That means no high fives, no hugs, no wrestling, kicking each other, etc. There will be no locker rooms or facilities available during these times. And make sure to social distance while you're waiting in line, starting performing an exercise, or arriving and leaving. Okay, remember your 3 W's. Wear your mask, wash your hands, and wait in line at the appropriate distance. Let's all work together to keep everyone safe and reopen our schools. If you have a question, ask your coach, director of activity, or school sponsors. Thank you and look forward to seeing you soon.
I would like to thank Dr. Judd Garbarino and athletic trainer Joel Moffitt for sharing their expertise with our students and staff. We hope this has been an informative time as we prepare to return to extracurricular activities. As always, the safety of our students, staff, and community is our highest priority. Thanks for doing your part to keep our teams and student groups healthy.